Thank you. Thank you for the introduction. As you can see, my basic question is, how can we improve patient safety? Is anybody familiar with this term? But you know what the other part is. The err is human, to forgive is divine, right? We have used it before. Well, basically, this statement was actually a landmark report in 1999 by the Institution of Medicine, where they actually, based on multiple studies, they actually found out that up to about between 44,000 to 98,000 unfortunately lose their lives because of medical errors. Okay? Now, that's not a very good sign. But we have come a long way since then. And what does my work as a computer science have to do with this anyway? We're looking at the development of software systems that have helped to improve clinical efficiency. Okay? I mean, if I were to ask you a question that, which is more efficient? A clinical setting that is without computing systems to help you actually carry out your medical work, or another environment or another system that has computing software that helps you to make your work more efficient? I'm sure some of you will move to the latter, right? However, there's a fundamental problem with that. Yes, it's true that computing software has helped to improve clinical efficiency, but unfortunately, accidents still happen. And why is that? Anyone? No? The software, they don't work by themselves, do they? Human beings use them. And as long as we have human beings in the system that use these systems, we are going to have errors. There's a chance that an error could happen. Now, in moving on, sorry, I think. Oh, I'm sorry, just one moment. There we are. Sorry about that. I think I'm just having a little bit of problem. Okay, thank you. Sorry about that. Well, why is safety important then? We're basically trying to, from the healthcare perspective, we're trying to prevent accidents from happening. Now, these accidents, they don't just happen in isolation. Sometimes these accidents happen when there are connections of people within the system, or what I would like to call a social-technical system. You have the clinicians, you have the doctors who use software systems, you have the patients who they are being treated, you have organizational rules and procedures of how things to be done, and then you have decisions that take place at the regulatory bodies and also at the government levels. And how do these components relate together could potentially have an accident. Now, why do we conduct accident investigations in healthcare in the first place? We want to know what happened. So if a serious incident happened, obviously there's going to be an investigation. We want to know what happened. We would like to know how this accident came to be. But more importantly, we'd like to know why they happened. Now, this is practically the most important part, because if we do not find out why these accidents happened or why they keep occurring, we would not be able to develop measures to prevent them from happening. Now, obviously, we have all had experiences going to the hospitals, and I'm willing to bet you wouldn't want to be in the situation where, because maybe a doctor misused the system or there was a misdiagnosis, that something will happen to you. I mean, you will be in the perfect position to sue them, right? Anyone? All right, moving on. This is film. Okay. Okay, right there. Okay. All right, so this is your typical socio-technical system. Now, what do we mean by that? So we are basically having different companies that work together in the system. So you have people. Now, in the healthcare setting, which is where my research work is focusing on at the moment, we are looking at the doctors that uses computers. You have the workflow and communications between them. You have the internal organizational features, and all these other components, including, not the least of which, hardware and software, and how they relate with each other. Now, obviously, at the beginning, we used to have paper-based healthcare systems. Now, I don't know if there's any board in Scotland or in the UK, for that matter, who's without using software, who are not using software for clinical purposes. And then, with the invention and implementation of health information technologies, the question has always been, how do we make them safe? How do we use them safely, and then how do we now improve on safety? I think we are now in a position where the bulk of the work and the focus is how do we now improve safety, okay? So, now typically an accident can happen because of error-prone situations or instead of error-prone individuals. Now, there used to be a culture that if anything happens because maybe someone misused a system, or maybe they were not well trained, or maybe something happened, it will be easy to blame them. They will say, oh, they are the ones at fault. But you see, that is not the most productive way of thinking things. If we want to find out what happened and how we can prevent them, we have to go beyond just blaming the frontline individuals that treat the patients. We have to look at the conditions, the environment they're working, what decisions were taken at higher levels that created the environment for the accident to happen, or what I would call the probability. For those of you in maths, we talk about the probability of an accident that is likely to occur. So how do we now improve, or how do we now reduce risk? How do we improve safety? Now, currently we have methods, what I would call cause and effect methods. I'm sure everyone's familiar with cause and effect. Okay, so okay, I think I missed something. Oh, there was supposed to be a diagram, but it doesn't matter. Well, this is one of those methods that I'm currently implementing in NHS. Now, this method I'm sure it looks abstract to all of you, but basically it looks at the socio-technical systems of people who work in there, the staff, the work, management, company, and government. And all these little boxes you're seeing here and all these directional arrows are the events, decisions that interrelated with each other that possibly led to a serious event. So this model allows us to give a graphical picture of what caused the accident, and then how do we now check which ones we need to prevent from happening. So we're talking about developing countermeasures to prevent them from occurring. So the focus of my research, because I'm in my second year right now, the focus of my research is how can we improve on this existing methodology with existing templates. Now, one of my diagrams will also be here. I don't know why it's not here, but my work will focus on how do we improve this methodology with existing ones that NHS use to conduct accident investigations, and how do we make them more reliable so that multiple people can use them and we'll be able to have similar set of results that will be able to give us more effective outcomes. And on that note, thank you.